this video, I'm going to expand a little bit more on why trauma-informed care should be the bedrock of how we look after patients in secondary care. You may be wondering what trauma-informed care is. Now, trauma-informed care is a series of principles and ways of managing patients who may have undergone some form of traumatic experience in the past when they were children, or even during their adulthood before they present to you. Trauma, when you look at it from that context, is exceedingly common. It is understood that almost 1 out of every 2 will have had some traumatic experience. And you may say that that's normal part of life. But Gabor Mate, the famous author, thinker, and physician, actually says that trauma is not what happens to you, but it's what happens inside of you when trauma happens to you. Which means that each person's response to a particular traumatic event, how you might have responded to COVID, or how I might have responded to COVID, or the pandemic, or isolation, or surgery, or anything, will be very different because each one of us will have a different set of beliefs, systems, immunity, nervous system sensitization when we experience a trauma. So how we respond to it will change as well. And trauma-informed care takes into account that realization, that response, and then that approach of preventing re-traumatization. Now, in the UK, there's been a charter that's come through into force last year, and a number of hospitals, including the one that I'm part of, has signed up to become what's called veterans aware. And this is to understand that our veterans have undergone significant trauma on the battlefield and therefore will be left with various physical and psychological problems, and the need is to provide an integrated way to support them in their rehabilitation. Now, I would argue that the principles of veterans care is completely the same as trauma-informed care. And so I would urge that if we are going to change and move our organizations to become veterans aware, then as an organization, we should also be looking at trauma-informed care for the rest of the population that utilizes any healthcare service, because trauma-informed practice is now becoming commonplace in social care, in justice, and in schooling as well. So we will just be making it uniform if we bring it to healthcare, and there are ways and approaches to do this. Scotland, in fact, is doing a trauma-informed workforce training, and that is what we all can be part of when we want to be trauma-informed. So Veterans Aware is the first step to making a trauma-informed care approach available to our veterans. And the next step will be to now make it available to all of us. Thank you.